Post-traumatic stress disorder is a combination of psychological, behavioral, and physical symptoms that result from an out-of-the-ordinary life experience in which one's life or integrity is threatened, or in which one experiences through others, witnesses somebody else's life in danger. Now, we often think of PTSD, post-traumatic stress disorder, in terms of combat situations, and that certainly is true. In my years, I've seen over 2,600 combat vets from Iraq and Vietnam who suffer from PTSD. But people can also get PTSD from a rape, an assault, childhood sexual abuse, and other situations in which one's existence or one's integrity is threatened or put at risk. PTSD usually results from out of the ordinary life situations in which one is at risk and during which a person feels helpless and hopeless and unable to help themselves. And the result of that is a group of symptoms which fall into three areas. The first is remembering the experience. So people with PTSD will often recall the experience in terms of daytime remembrances, in terms of nightmares, in terms of flashbacks, which is a reliving of the experience. When we recall an experience, we remember it. When we have a flashback, we relive it. And people with PTSD will remember in terms of getting severe distress at things which even remind them. It might be a smell or a sound or a sight or a color which may bring it back up. So the first group of symptoms is re-experiencing. The second is what we call avoidance. People will avoid thinking or talking or even recalling the event if they can. People will change in terms of their interaction with others, so they'll begin to isolate, detach, and withdraw from other people. They'll avoid social situations because they don't necessarily want to be around others who might ask about the situation. They might have blunted emotions where they just have a hard time experiencing any joy or happiness or even sadness in their life. They have a blunting of their emotions. Often they'll have a sense, it's interesting with my combat veterans, I'll see, technically it's called a sense of a foreshortened future, where they'll say, you know, it's really weird, Doc. I think something bad's going to happen to me all the time. I don't know what it is. I just think it's bad. And then the third group of symptoms, besides re-experiencing and avoidance, is what we call arousal. And arousal involves generally being easily startled. So people with PTSD will jump at loud noises, will jump at people coming up from behind them. The most poignant example of that was a Vietnam vet I saw recently who said, Doc, he said, I'm so embarrassed. I've never told anybody this. He gave me permission to tell it, by the way. He said, you know, my little 3-year-old grandson came to stay with me. And you know how kids do. He came and put his hands over my eyes, you know, without my realizing he was going to do it. He puts his hands over my eyes. He said, and all of a sudden tears start rolling down this big burly guy's cheeks, and he said, you know what I did? He said, before I realized it, I took my arm and I slung him, and I heard him hit the wall. This 3-year-old kid, he didn't mean anything by it, but this guy had this easy startled response, and when the kid came up and did that, without thinking, he flung him against the wall. Another of the arousal symptoms is lack of going to sleep or staying asleep. And finally, being hypervigilant, that is, looking all around and suspecting everybody of God knows what. And so those are the symptoms that we often see: arousal, avoidance, and re-experiencing. And as a result of post-traumatic stress disorder, people often withdraw into themselves. They stop going out socially. They stop interacting with other people. And often to treat their insomnia and to treat their symptoms, they turn to drugs or alcohol. And we see a lot of people with severe PTSD who develop alcohol abuse or drug abuse.